Hello everyone and welcome to our presentation on inequalities in perinatal healthcare for trans people in England. My name is Tash Oakes-Monger and my pronouns are they, them.
My name is Ruth Pearce and my pronouns are she and her. So today we're going to be talking about initial findings from the ITEMS project, Improving Trans Experiences of Maternity Services. And we're using trans here in a way that is inclusive of non-binary and genderqueer people. And this was a collaborative research project led by the LGBT Foundation, involving organisations such as the National LGBT Partnership and also the Trans Learning Partnership, of which I was a part when the research took place. And it was funded by NHS England. And the context for our research is that in England, NHS midwives are available to all birth parents for free. And this is through the perinatal period, that is covering pregnancy, birth, and post-birth. However, there's not any existing research or guidance, specifically in the English context, on the needs of trans birth parents. So this research sought to find out more about the experience of trans birth parents in order to inform midwives, and we will also be producing recommendations. So what we did was we undertook a mixed method survey, and this included statistical data collection and free text box for qualitative data connection. We also undertook qualitative interviews, although today we are going to be focusing on findings from the survey. And the design of our questions was deliberately done to align with the design of the Care Quality Commission Maternity Services Survey. And this is a national survey which is done to find out the experiences of cis women who give birth. So we wanted the experiences of trans men and non-binary people to be directly comparable with women. Another thing we did with the design of this research was targeted recruitment of trans people of colour, which I'll be looking at in more detail in a moment. And our analysis is in progress. So today we'll just be looking at descriptive statistics from the survey, but we're planning to do a full statistical analysis in the future. So here is an example of some of the targeted recruitment and incentivization for trans people of colour to participate. This was really important for several reasons. One was that, as writers such as Cyrus Marcus Ware have pointed out, from a perspective of a Black trans parent, there are experiences that trans people of colour have at the intersection of experiencing potentially racism and transphobia, but white trans parents will not have. And secondly, trans people of colour are underrepresented in most trans healthcare research in the UK and also in most research internationally on pregnancy, fertility and childbirth to date. So in collaboration with our colleagues who are trans people of colour and queer people of colour within organisations such as the LGBT Foundation, we used approaches such as this poster to ensure recruitment of people who saw that actually we were interested in having their experiences and their lives captured in the research. And we were also paying people for their time to recognise that it can be quite a lot to take part in work like this. And so I'm going to talk briefly about demographics. We had 121 eligible responses, which means, as far as we're aware, this is the largest survey of its kind in Europe. The mean age of trans birth parents was 31 at time of birth, which broadly reflects what we know. It's quite similar to women who give birth. 29% of participants were disabled, which reflects what we tend to find with the wider trans population. And in terms of ethnicity, we ended up with a sample which we felt that the process of intentional recruitment of trans people of colour was broadly successful. we've got a graph here where the terminology we've used is in line with what's usually used in British research, such as the Maternity Services Survey, although some of this language isn't what we would have preferred to use ourselves. And so we're hoping there's a way of using, having more community input into design of survey like this in the future. We're quite pleased with the diversity of the sample, but Asian and British Asian trans people were underrepresented, and this is something to address in the future. In terms of sexual orientation, the majority of participants were bisexual, pansexual, or queer, which again reflects wider trends within trans communities in the UK. And we were also really interested to see that there appeared to be an increase in trans people giving birth every year, which reflects anecdotal observations that people have been making for some time. So it was quite exciting to get data on this. So next we're going to move on, and Tash is going to talk about our main finding.
So yeah, this was one of the main findings of the research, and a really interesting one. So 30% of respondents in our sample did not access any support from NHS or private midwives during their pregnancy or pregnancies. So this is sometimes called free birthing. We don't have many statistics on free birthing. However, we do have a comparable statistic from the ONS 2019, which found that 2.1% of women who gave birth did so at home. So obviously this statistic includes those who had access to maternity care but chose to give birth at home, and also those who gave birth before they could get to their birthing place. So the real number of women free birthing, or more accurate number, is probably lower than this. So the reason we were interested in free birthing in particular is because free birthing carries some extra risks. So because of the nature of free birthing taking place outside of the healthcare system, we don't have much data on risks associated with this. However, researchers suggest this may be similar to the risks associated with births before arrival. So births before arrival are where someone has given birth before they get to hospital, so they give birth without a midwife present. And risks associated with births before arrivals are blood loss for the birthing parent and a failure to maintain body temperature for the baby. So this was really important given that such a high proportion of our sample were free birthing, and this proportion was even higher amongst trans people of colour, with 46% experiencing free birthing compared to 28% of white people. This is particularly an important finding because of what we already know about people of colour in pregnancy, and the 2020 Embrace report finding that Black women were over 4 times more likely, and Asian women twice as likely, to die in childbirth compared to white women. So that was really important. So we decided to look into the experiences of free birthing a bit more. So initially, a finding here that the desire to free birth was quite high amongst our sample. Almost 65% of those who did free birth wanted to free birth. However, when we looked at those that felt that free birthing gave them the experience they wanted, this number was slightly lower at 52%. And then those that would free birth again was lower still at just 43%. So it was important for us to look into a bit more, perhaps the reasons behind why we had such high numbers of free birthing. And we found that of those who free birth, 30% of those people agreed that they would not have considered accessing maternity services. Almost 40% said they would have been uncomfortable accessing maternity services, and only 20% of those who free birth reported feeling confident to access maternity services, even if they felt that they needed to. So this was a really important finding for us because it suggested that a large motivator for free birthing was discomfort in accessing maternity services. So part of the reason why we thought this was important to look at is that there is a lot of data amongst cis women that shows that people are free birthing as part of an active choice to do with empowerment. However, we found that roughly half of our sample who free birth agreed that it would have been helpful for them to have a midwife there to support them during pregnancy, labour and birth, and in aftercare. And that, coupled with the feelings around maternity services, suggests that free birthing in this population is actually largely motivated by a desire to avoid maternity services rather than not wanting a midwife to be present. So further research could focus on whether this reluctance is associated with discomfort around maternity services and the level of training that midwives may have around trans people, or whether it's more specifically to do with the hospital-based environment. As if this is to do with the hospital-based environment, there may be a lack of understanding or knowledge around the services that are actually available to trans and non-binary birth parents, such as the opportunity for a home birth.
This idea around the possibility of negative experiences in hospitals was actually borne out in a lot of our data on people's experiences of perinatal care. Respondents reported a range of experiences. Many had very good experiences and felt supported by midwives who were really focused on person-centered care. However, many also responded negative experiences. And one common issue was misgendering. And we can see a graph on here saying that only 41% said that they were always spoken to in a way that respected their gender. This is likely to impact the health of the parent and the baby. And Tash, you were going to talk a bit more about that.
Yeah, so I think this is one thing that we really pulled out, because obviously misgendering can contribute to depression, anxiety, and low self-esteem. And we know from research and evidence that depression, anxiety, and stress during pregnancy can result in miscarriage, in low baby birth weight, and consequences for infant development and into the future. So this was really important as a finding for us.
We also found that trans people appear to be more likely to receive inadequate care across the board when compared to cis women, and we're going to return to some that in a minute. But first, here's a couple of quotes from research participants that are really digging into that question about misgendering. The first from a participant who described themselves as non-binary, no gender, queer, Black, and disabled. And this participant said, "I felt there was no framework of language that was inclusive of people who do not identify within the gender binary, so it's consistently a triggering experience." We also had a more complex accounts from some participants who had bad experiences but potentially downplayed some aspects and not others. So for example, a participant who described themselves as non-binary, transmasculine, and white said, "I can't praise my mental health midwife enough, despite the fact she frequently misgendered me. But the rest of the team didn't really acknowledge or take into account my transgender health medical history." And this reflects findings by researchers such as myself and Ben Vincent, showing that trans people often downplay negative experiences or are prepared to accept certain experiences as acceptable because they're so used to having bad experiences of healthcare. So a very quick look at some examples of the findings comparing trans birth parents to cis birth parents. We asked, thinking about your antenatal care, were you involved in decisions about your care? And 62% of trans birth parents said yes, always, compared to 82% of cis birth parents. And similarly, when we asked about labour and birth, were you involved in decisions about your care? Only around half, 53% of trans birth parents said yes, compared to 82% of cis birth parents. And we had many more findings like this in response to a lot of the questions. So in terms of next steps, we're going to produce a full statistical analysis and report looking at these numbers in a deeper way. We are also planning to produce recommendations for midwives and service providers. These are going to be co-produced with birth parents and birth workers who are involved in the items project. But we'd also like to know if you have any proposals. So we're going to put a Padlet link into the Zoom so you can have a look. We're also going to do an academic write-up of our findings. Finally, and we're going to put this in the Zoom and also into the conference programme, you can find some resources produced through the NHS by the Brighton and Sussex University hospitals on how to support trans birth parents in practice. So those are some existing NHS resources. And there's also some resources available from the Trans Pregnancy Project, which I was previously involved in. Thank you for listening.